Hi everyone, this is Dr. K. I wanted to talk about some trending topics in COVID today. Apparently there was a news conference and they were talking about this new medication, Remdesivir, and they said it is a promising medication for COVID-19. So I want to briefly review the study that, hi Lorena, I want to briefly review the study that they pointed out. In this study, they had 36 patients whom they followed for a median time period of 18 days. And some of them were on the breathing tube with the ventilator. Apparently 57% of the people who are on the ventilator, they had a good result. They removed the tube after a while, and most of them eventually went home. So a lot of them survived. So the results are promising, but this is a small study. It only had 36 people. We really, I think it's a good step, but we're really not sure if this is the way to go. This medication was used in several of the patients. I was not part of their care, but I heard from some of the doctors that they use the medication, and they still noticed in their clinical practice that the patients eventually died. So and again, this is not a one-shot thing where you use this one medication. Even in this study, this medication was used along with other medications that the doctors were using. So there's a lot more questions, so a lot more research is needed. I want to give a brief background on why they chose this and why it would make sense to use it. The SARS-CoV-2 virus is in a lot of ways similar to HIV, and a lot of scientists believe that there are components of HIV inside of this virus. So this medication Remdesivir, it inhibits or it blocks the RNA-dependent polymerase. So the virus cannot multiply the RNA inside of it. So it blocks that particular enzyme. They also are studying two other medications. One is ritonavir and lopinavir, and both are used mostly for HIV. So they're also studying this medication in another study called Solidarity study, and those results are still pending. So so these HIV medications may benefit the patients. We have to wait and see. As I said before, most of the patients are dying because of the cytokine storm. The body's immunity goes into an overdrive. It starts attacking all the cells, and most people die from the immunity going out of whack. So it starts with the virus, it starts with the infection, but eventually it's the cytokine storm that leads to the eventual death. From what I heard, we're still not completely sure. So some exciting news. We have to wait and see. I think presently, a lot of hospitals have access to Remdesivir. It's part of an investigational drug trial. So they are using them on patients along with a whole bunch of other stuff. In my mind, the most promising thing is the plasma transfer. They call it convalescent plasma. So they take the plasma of somebody who has been cured or who has recovered from COVID-19, and they use that plasma because it has the antibodies against the virus in the patient who has the ongoing infection. That seems to be the most promising, and again, we don't have trials or results from studies, so we're waiting for those. So look forward to talking to you all again. Thank you for listening to me. I'll catch up again tomorrow. Thank you. Bye.